Danny Shapiro. Welcome to the podcast.
Happy to be here. Happy to be here, Ronnie. Thank you for having me on.
Heck yeah. Thank you for saying yes. And you have a podcast now as well. So I think we're going to reverse this and I'll be your guest also, correct?
Absolutely. Yeah. We have to do it. We have to do it.
Will I be your first guest?
You will be my first, let's call it the official provider guest. The way I've built the podcast was I go on a rant, I pick a topic to rant about and go crazy about, and then actually have live callers, like random people who agreed to be on the podcast. We randomly pick them, and we had two callers yesterday, from one from PA and one from I forget which other state it was, but yeah, like random people across the country, and just talking to them about their health, about their issues, and how I can help guide them through. It's really cool. But you'll be my official, my first official, med guest.
I mean, I'm happy to be that. Also, that sounds like a pretty cool setup. So you are posing these questions and then looking for people that want to call in and ask questions, and then you're giving them real-time advice and talking them through things.
Yeah, so the topic I pick, sometimes it's relevant to what someone's case is or not. I pick a topic, and then whatever, the only thing I know about the callers initially is literally their name and where they're from. Then it's completely around, like whatever they want to ask me about, whatever they want to tell me about, it's entirely up to them. But I get to actually hear them out and provide some context and some extra information that either they didn't consider or the providers didn't consider. It's really cool. It's
That's a
shaping
cool
up to something
concept.
fun.
And it kind of makes me think of the old school radio shows. You're like, okay, we've got Judy calling in from Jersey City. What's going on, Judy? Then she tells
Literally.
you, then she talks to you about her knee pain.
Exactly. Now we just need the little call music in between. Now we're just we got to get that going. But otherwise, it's pretty much that was the inspiration behind it. We wanted to kind of make it a little bit more old school and bring that back.
I love it. What's it called?
It's called Built to Endure.
Cool. And
Yeah.
Project Physical Therapy is your physical therapy company that you founded.
Yep, it's been almost, in a couple months. It's gonna be 6 years since I've had my baby, and it's
Wow.
she's growing up big and strong.
Congratulations. That's a big milestone. I don't think I realized that you'd been in practice that long. How have the past 6 years been?
It's definitely been eye-opening. I mean, look, obviously the ebbs and flows of running a business. I know I don't need to tell you that, as someone who also runs their own show. But that aside, it's incredible to be able to help and serve the people that have trusted us and come through our doors, or that we worked with virtually since COVID. And it's really, really eye-opening, the things that we see. People who've had pain for such a long time, months, years, decades, and we crush it, pretty damn seamlessly within a few weeks or months. My goal is to always end the medical roller coaster as soon as possible for someone, because the sooner we do that, the sooner they have their freedom and their life back, and their independence back, and their ability back, and their belief in their own body back. And that's all we ever strive for. That's our main mission, our main goal in Project Physical Therapy.
Very cool. And you are an out of network provider in New York, correct?
Yep, yep.
Were you always out of network, or were you taking insurance at one point in time?
Nope, since day one. Since day one. My father was a podiatrist, is still a podiatrist, and I heard since I was a little kid, I've been hearing all the faults and problems within the healthcare space because of health insurance. Every year, I'm sure you know this too. Every year, reimbursements get less and less, and yet the cost of living, the cost of price of just business costs all keep going up. Salaries keep going up. And people a lot of times are forced. A lot of clinics are forced to water down care, see 3, 4 people at a time, and that ain't it.
That ain't it. That
That
ain't
ain't
it.
it.
Why do you think that is? Why do you think reimbursement rates are plummeting in the way that they are, but insurance companies are still growing and still taking on, uh, you know, new clients every day? Is it because they don't see the value in physical therapy? Are they just trying to trim the fat and save as much as money as they can? What do you think is behind that?
I just think it's because they can. But nobody can really say much. There's not enough people that can fight back. And the PT lobby, at least in New York State, I know for sure, the PT lobby is weak, really weak. Like, we still don't have direct access in New York State.
Really?
Yeah, it's still partial. You need a referral from your doctor after 10 visits or 30 days, whichever comes first. Like, in New York State, we still don't have direct access. How crazy is that? Chiropractors all good. Acupuncturists I think also all good. PTs nope. Nope.
Wild. Wait, that's wild. Like, yes, I can adjust your neck and I can stick you with a needle. No doctor referral required. But you want to exercise? Mm-mm. Sorry, no.
That's crazy. No. No, no, no. Not in my
That's
house.
not safe. We need to get a medical recommendation.
For real. No, no, it's nuts. So, you asked why. Because they can. Nobody fights back. I think the way it's going, though, there's going to be more and more and more cash clinics the more this goes because it's unsustainable. It's not, you can't do it. Again, essentially, enough people are going to get stuck through the system where people are going to just start leaving these insurance-based clinics.
Yeah.
Yeah.
And by people, I think more so even physical therapists, because
Yeah.
we are really the ones. I mean, definitely the patients are feeling the burn of not being the only patient that's being seen in that hour, but the physical therapist, even more so, is the one getting burnt out. I mean, I can speak to that. I'm sure you can speak to that. I think PTs are realizing now more than ever that they can go off and do their own thing. I mean, it was easy as me just starting out in a private personal training gym and folding out my table and saying, okay, we're open for business, alongside all the things that I had to do to start my business. But I think it is more feasible now. People, they're more exposed to it on the internet. They see that this is something that I'm doing. This is something that you're doing. And you don't have to hate your life and hate your job if you're working an outpatient and you're taking insurance. But I remember when I was working, before I got into physical therapy school, I worked at a PT clinic, but I was doing insurance verification benefits, like working the front desk, but I also was in charge of figuring out, like, were you going to be covered or not? And I remember it was just the federally funded insurance companies that required pre-authorization. So like, your Medicaid, your Blue Care. And that's how it was back in 2017, 18. And nowadays, this is right before I left because I haven't taken insurance in a while, so I don't quite know where things are. But when I was at my old job, almost every commercial insurance company to some capacity was now requiring like authorization or review of your documentation before they covered people's visits. And yeah, it's just sad. It's changed a lot. Have you seen similar change in New York?
I will say because again, I've never worked with insurance companies. Right, the most I've ever dealt with insurance companies is through rotations when I was helping with billing.
Mm.
And even that was like I realized even early on there, I was like, "There's no way I'm going through this whole rigmarole, and I ain't doing this.
It's not for me.
It's not for me." But I'll tell you what, though. So a lot of my patients have pretty good out-of-network benefits. Some cover like 50%, some cover 30%. I have a few patients that cover like 99% where they're paying like $2 a visit essentially. Like it's really good. But you know what I've noticed over the last, I would say, year or so? Insurance companies have started to request notes more. So like usually you submit a super bill and whatever the reimbursement rate is, they
Right.
usually don't bug you after that. Maybe they'll ask you for an eval note or whatever it is, but now they're asking for all notes. They're trying to make it
Ah.
harder, and to me, like as a provider, like we got to do notes regardless, right? But they're trying to delay the payout process that much more because the patient sends a super bill. Nah, we need the eval. Okay, we send the eval.
Mm.
Nah, we need all the notes. We send the notes. Oh, this code wasn't right. No, the code is right. No, we don't see it. We didn't get it. And it's been 9 months, and like the patient still hasn't gotten their fully deserved payout because these insurance companies want to hold on to every single penny they can.
That's depressing. They've caught
It's
wind of what we're doing.
oh, that's what I'm saying,
No,
right?
I hate to hear that.
Oh my,
Dang
it's
it.
it's horrible. It's ridiculous. Like for the patient, it sucks.
It is, yeah. And at Project Physical Therapy, I'm going to make an assumption based off of your social media. You treat a lot of chronic pain. You advertise yourself as like a chronic pain specialist. And I do think a lot of the content you make is geared towards that person that has been having those nagging issues. Is that a lot of what you see in your clinic as well?
Yeah, I mean, we do see acute, raw injuries too, but I'll say like that's maybe 10%. What we really specialize in is the chronic stuff because, with chronic stuff, and I'm sure you see tons of it too. It's not just the physical anymore, right? This is someone's been in the hole for a long time, and now it's emotional, it's psychological, it's a disbelief in your body that you can't trust it anymore. And so what we do is not only work through the physical aspect and getting them strong again, showing them, hey, your body actually has a lot more juice than you think. There's so much more that you can do. You can get back to running. You can go hiking. You don't have to be scared to lift up your kids. Like you can do so much. We tackle the physical aspect of it, but we reinforce it with that emotional aspect as well to help motivation, keep the motivation high, determination high, and keep the spirits alive. Especially with chronic pain, there's a lot of ups and downs,
Mm.
flare ups, and as you push through different levels of intensity and certain things. But yeah, I love treating people who have been stuck in the pain for a long time.
You're like a diamond in the rough because I think most physical therapists would say the opposite, myself included. I like the person that's like, yeah, I am training for this marathon and I'm having this pain and I need help. And this just happened last week. I think it is just a whole different ballgame to try and treat that other level. It's like the therapy part of physical therapy alongside the physical part.
Hmm.
Uh, I mean, I wouldn't say I'm bad at it, but it is just it's all encompassing, and I do think it makes the recovery time longer. I'm sure you're an expert at this point. You've been doing it for 6+ years, but I would say most physical therapists probably are like, "Oh no, chronic pain." When they see that on a script, they're like, "Ugh, give it to somebody else." But you're like, "No, no, give them to me."
No, I'm like, ooh, here we go. Let's
Yeah,
go. Let's have at it. Yeah, big
cool.
time.
Yeah, wait, okay, so then if that's the case, do you have a specific success story that sticks out in your mind? I mean, I know it's been several years of you doing this, but do you have one person that you're like, "Yeah, we made a huge difference."
One, I mean, I got a few thousand, but
Oh, flex.
uh, I mean, if you just want one,
One that made an
uh,
well, I guess in this case, it would be one that really made an impact on you.
well, how about this? I'll give you a recent example. I'll give you a recent one. Okay, so and this one, oh God, there's so many good recent examples too. So many good ones. Okay,
I'm
this
doing
one,
so much good work, I just can't even pick one out.
God, there's so much dust on my shoulder. I gotta brush it off a little bit. No, so there's this one woman who came recently, like literally within the last 2 weeks, and she's been in pain for about 17 months, and which is funnily enough on the lower end of the chronic. Like I typically the people that come in, I mean, they've been suffering for a long time. We're talking like 5, 10 plus years. Another story. I mean, I once had a woman come in with 40 years of bilateral knee pain. That was a wild trip. What we did in like a couple sessions was nuts. But anyway, 17 months, and so she came in with this giant like waist brace, like strapped in around her torso.
Mm.
She came in with a cane. Young girl, mid 30s, like young, could barely move. Was in tremendous amounts of pain. She had lost all hope. She's been through therapy. She's done all the things like that you would normally expect. You go to the doctor, there's pain medication. Okay, try therapy, and it seldom ever works. Um, and I mean, she was on the verge of tears. Like she just didn't know what to do with herself anymore. The pain was overwhelming. She couldn't walk. Sleeping was painful. She had a kid. She could barely take care of the kid. Single mom. It's tough. It's really tough. Um, I remember when we sat down for that evaluation, she was so nervous just taking off the brace. She was so scared. She hadn't stood up pain free in 17 months. She hadn't touched her toe, like tied her shoes pain free in 17 months. Within 45 minutes, she did both for the first time. Both.
What did you do?
Can't say it. No, I'm kidding. No, what we did was, so I mean, through the evaluation process, we have hundreds of tests that we can choose from. We start from one, and based on the reaction, the feedback from that very first test, that will literally dictate the next test that we do. There's nothing generic or procedural about it. There's a few tests that we generally do want to see the responses to. That is the baseline to determine what we do next. Uh, but essentially, we try to see, okay, like where are the deficits? What are the limitations? What are the restrictions? How much of it is actually joint? How much of it is tissue? How much of it is nerve tension? What are we actually looking at here? What are we actually working through? Then, on top of the physical testing, we also kind of, as we're doing the physical testing, we look out for what is the hesitation that the patient has? Like if we asked them to do a side bend to the left versus a side bend to the right, which one are they more hesitant about? Which one are they more anxious about? And then we ask why. Right? What are you scared of? What are you afraid of? Right. So there's a lot of mental and physical coaching alongside. They run side by side with each other when
Mm.
as we do the evaluation. And so just naturally by the evaluative process, we start opening things up. Muscles start like waking up, let's call it. Um, and because it doesn't hurt, the patient's confidence goes up. They start to they stop tensing. They start to believe in themselves a little bit more, even within that short time span. And then, I remember did a whole bunch of things with her. It was all seated, by the way. I didn't have her stand up once during the testing process, not once. And then, right towards the end, I said, "Hey, do me a favor. I want you, in a moment, I'm going to ask you to stand up. I want you to remember before the last 17 months of pain that you had, try to remember the last pain free day that you have experienced." Right? You never thought about standing up. You never considered what is it going to be like? How do I have to position my body? Right? You just stood up. So I want you to, for a second, think back to that moment before this pain started, how you normally would stand up. And I want you to imagine you're that person again. I want you to take a deep breath. On the breath out, push through your heels and just stand up without hesitation. Here we go. 3, 2, 1. And she pops up. No pain. It's cool. It's really cool.
Cool. It's a very cerebral approach, which I think you have to have if you're treating chronic pain patients. You must have taken a good amount of like pain science continuing education courses, or at least done some research into that, on top of the fact that, you see the same type of patient over and over again. You're going to get good at knowing what verbal cues and sort of how to alter your approach per patient, depending on how they're presenting in the clinic. Do you know a lot about pain science just from
Yeah.
everything that you've been doing?
Yeah, I love pain science. It's truly fascinating because it connects everything together. And again, I love treating acute cases too. Like again, do not get me wrong. I love it when
Yeah.
dancers come in. As a former dancer myself, a lot of ballroom and ballet dancers come in all the time, and like I love treating those acute injuries. They're a lot of fun, but the chronic stuff requires a higher level of like that kind of like pain science because again, you're playing through so many different layers of restriction and limitation, both self-imposed and otherwise.
Hmm.
And you got to bridge the gap, and it's so cool. It's so freaking cool.
Yeah, it's a very rewarding feeling to make that breakthrough, I guess, for lack of a better term. It is kind of a breakthrough for someone to be able to realize what they're capable of. And it really is pain science at its core. I mean, I don't know what her physical limitations were, but a lot of times you don't want to tell somebody it's all mental, but if you can just show them what they're capable of, then the rest sort of just follows alongside just nice and easy.
Well, see, I mean, the thing is, like, what I found with chronic pain patients is that because they've been given just general things to do, like again, what is a typical PT experience for low back pain? Right, glute bridges, clamshells, monster walks, hamstring stretches, bicycle, hot pack, cold pack, e-stim, ultrasound, 7 minute massage because that's a unit that they can bill for, and plus minus a couple other things, right? Like that. That's like I
You
just
got it. That's it.
that's it. Like again, plus minus one or two things. Right. When that inevitably fails because there's no coaching involved, there's no actual, like, they'll say, "Hey, do this exercise for 10 minutes. We'll be right back." And it's like, you have no idea if you're doing things right. You have no reinforcement. You have no coaching. You have no actual, like, someone there rooting you on. Even if you have an assistant or an aide, they don't have the independent ability to alter any part of the plan of care without the actual therapist. So you're wasting time. And again, that kind of cookie cutter stuff eventually doesn't work. And so, what does this person do? They've been through therapy, that hasn't worked. They've tried pain medication, that hasn't worked. They have tried injections, that hasn't worked. Okay, so the only option that we have remaining is that we have to restrict and limit everything in my life. So, what happens when we move less, right? We get weaker, right? We don't move, we get weak. What happens when we move less? Our joints start to stiffen up.
Yeah, no, everything hurts.
Everything hurts.
Yeah.
Yeah, and so the problem cascades over time, and it starts to morph and change and evolve into something far greater. So, I mean, this is how she. I mean, she came in for the second appointment. She still had the cane, but cane was in the air. She wasn't using it. You
I
know?
love that. That's awesome.
Yeah.
Did she have the brace on? Are we still wearing the brace?
Oh, so she came in. So she came in for the second appointment, and she was leaving. She was actually working with my other therapist, Dr. John, absolutely awesome guy, and she forgot the brace in the room which he hasn't done in 17 months.
Oh, that's the best feeling.
He told me that, right? Because I did the evaluation, and then he's actually doing the POC just because again our schedule just didn't line up. But yeah, he told me that. I was like, I came into the room on the next session, and hey, I heard what happened. I high fived her. I'm so proud of you. She goes, yeah, this is like I'm finally starting to see changes. This is amazing. I'm so happy. I'm like,
Oh,
this is why we
that's
do
what
it.
you mean when you said magic. Yeah,
Yeah.
someone forgetting the brace is that trumps any objective measure that you could possibly measure. I mean,
Hmm.
that's huge. She left
Although
she left her baggage at the door, you know?
pretty much, yeah. Because in the beginning when we first sat down, she called it her best friend, right?
Wow.
And I told her by the time we're done with you, you're gonna be calling that your worst enemy. You
Yeah.
know.
And then like one visit later. That's incredible. I'm curious with you being mostly chronic pain specializing, but also an out of network clinic. Do you work much with pain doctors? Because, I'll get patients, I guess not really anymore, but back in the day that are like, oh, I got to go see my pain specialist first before I do anything else.
I mean, they all hate me, but
Yeah, I was gonna say they're probably like,
yeah,
don't go see Danny.
yeah. Don't go see Danny. But here at the same time, here's a couple more prescriptions for some more pain drugs.
Yeah. Yeah.
Um, no, I don't partner with pain docs. Again, funnily enough, I've gotten random referrals from different doctors, one or two pain docs here and there, surgeons, PCPs, nutritionists and dietitians who've heard of me through
Mhm.
social media and stuff like that. But I definitely don't. I do not get referrals from pain docs or on a regular. That's nah.
See, that's sad. And maybe one day in the future, it won't be the case. And they'll be like, what a collaboration. We have a physical therapist that specializes in chronic pain, and then we have a chronic pain doctor. Maybe we can work together. But I don't know. That might just be me shooting for the stars, and that's just not going to land.
I mean, you and me both. To be honest with you, it seems like and I've spoken to a couple doctors about this, and I don't really know what the majority think, and I'd be very curious. The majority of doctors, right? I mean, even pain docs, if they do send a referral to PT, it's either someone within the same network, like within the same building, right? So it's like, hey, we got PT down the hall, we got chiropractic acupuncture down the hall, have at it. Which is again your typical PT experience, and then otherwise they'll send you to some other hospital affiliated thing. And so it's almost like every referral that the doctor may have is your just generic typical PT experience.
Right.
I mean, something to think about. I have seen thousands of people up until this point, and think about all those people for the most part, let's say 97%, they all have PCPs. And so at some point, those patients are going to go for their yearly visit or their, follow-up visit, and the doctor's like, "Hey, I see in your chart you had some horrendous shoulder pain. You had some horrendous knee pain. We were talking about doing a knee replacement. How's your lower back pain? We're talking about doing a nerve ablation. Are we ready to schedule that yet?" And they're like, "Oh, well, I don't have any pain." And the
I saw
doctor goes,
Danny. I'm
"What?"
good.
Yeah, but then I never hear from that doctor. I never get a referral from that same doctor. Even though I did miracles with his patients,
Interesting.
or her patients, or like whatever it is. Like nobody ever, like I know they've heard about us. I
Right.
know they've, and again, we gotten a few, but for the volume of people that we've seen and how many people we've helped, it's kind of very interesting. Either they're bound to refer within their own network, or again, I don't know what it is. I don't want to assume, but
Right.
you know,
Yeah. That is interesting. You said former dancer. You mentioned that you're a former dancer. I beg to differ. I think you're still currently a dancer because I follow you on Instagram. I see what you're putting out there.
I'm
uh,
doing what I can.
talk to me about your dance background. I also am a former dancer, current dancer also
Yeah, there you
online.
go. Yeah. Well, hey, dancing is dancing, right?
That's right. Doesn't matter.
Exactly. No, so I used to be a professional ballroom dancer. I did,
Professional? That's so cool.
yeah, I was a United States champion. Um, yeah, it was a good time. It was a good time, and I did it from about 4 years old till 20. That's when I went to PT school, and I've been traveling the world from 10 years old until 20 for different world championships and
I did not
representing the
know
United
that.
States. Yeah, it was a pretty serious deal.
You were like in the dancing Olympics, basically.
Kind of. Yeah, no. So like it was dancing was a big part of my life. You know, my father most of the time he would wake me up in the mornings before school, would do some training, and then obviously as soon as school was done, straight to the dance studio, dance for like 6 7 hours. During the weekends it would be even more. There's no off season. There were times when I was in school. I remember I used to live out of a suitcase because I would travel for a massive competition, come back. Then it was national championships, come back. Then I had to go to world
Wow.
championships, come back. Yeah, so dancing has been a very, very serious part of my life for a very long time.
That is really cool. I didn't realize that you were that serious about it. What's the best place that you traveled with all of those competitions?
Ooh, oh man. I would have to say, oh man, I don't know. It's a tight race between Venice during the Venetian Carnival and South Korea.
Whoa. Yeah, two totally different ends of the spectrum also.
Very much so, yes, very
Yeah.
very much so. But both, I mean, every country I went to was incredible. I've been to Latvia, Finland, England, Italy, like I mentioned, Netherlands, Russia, South Korea. I mean, it was so many incredible countries. It was really, really awesome. Yeah.
Wow. Yeah, I mean, I think your dancing skills is probably what brought me to your page. It's fun when you can combine both dance and physical therapy, which I feel like we both it's such a niche thing to do, but somehow I managed to do it, you managed to do it. Do you think that it's played into the fact that now you have almost 300,000 followers on Instagram?
Probably. I don't know. I don't know if it's my rehab exercises or the torque in the beginning and the end. I don't know, but
It's probably like half and half.
half and half. It is what it is. Listen, honestly, at the end of the day, the dancing, while fun and keeps things light and positive, it's a scroll interrupt, and whatever gets people to stop a second. And okay, like this guy's kind of crazy. What is this, you know, big man doing? What is he
Why
shaking
is he
around
twerking
for?
on screen?
Oh, but wait, there's a move for low back pain. Let me check this out. And then they try it, and I've gotten so many messages over the years, so many messages of like, "Hey, I tried these moves here, and this has done more for me than 10 years of PT. Thank you so much." And hey, by the way, hi from Australia. Like,
Yes.
oh my God, cool. We're having a world impact.
Yeah, that is the best part. Your exercises also are interesting because I'll be watching your video and I feel like I know what you're about to do. And then you do something different, like just ever so slightly different. And it's something that I've never tried before. Me, as a physical therapist, having treated for some years now, how do you get your inspiration for the exercises? Is it just trial and error with patients that you're seeing?
So, I mean, this is kind of how we built up our HEP database. So, like, our database has around, I don't know, 8 or 900 moves up to this point. And we're constantly creating new ones every single week because we find a new variation of movement that works. A lot of time, the movements that I usually film for patients or try with patients is something that I play around with first. I want to see how it feels, where do I feel it, and then kind of like as long as it's obviously safe, then I'll do it with my patients. The moves I post on Instagram are in what I try to really do, and what I post on Instagram is just a fraction of our like what we do, but I try to make it as accessible and doable as possible.
Like minimal equipment?
Minimal equipment, like even if like you're in really rough shape, you could probably still do it and actually still see some benefit from it.
Mm,
Obviously, it's social media, like it's not specific to anyone's issue, but it's literally just to get someone to try something rather than doing nothing. But to do so, again, the moves have to be somewhat doable and look interesting enough. Like, oh, like you just said, like I've never seen that move before.
yeah.
What the heck is that? And then
I
try it.
I love that you're calling them moves. Not exercises, they're moves because we dance.
Yeah, well, exactly.
Try this move.
Exactly. Yeah, I mean that's what it is. By the
Yeah.
way, Ronnie, you still owe me an explanation on your dancing background.
Oh. Oh, should we save it for the podcast? No. I'll,
We can. Up to you.
yeah, no, I did not start at 4 years old. I didn't start dancing until I was 8 or 9. For some reason, my mom signed me up for a dance camp with my 2 little siblings, and it was at the local high school, and it was these, really cool high school girls that were teaching this dance camp, and so I just thought they were, I was starstruck, me, 8 years old, looking at these 16-year-olds dance, and I had never done a sport before other than gymnastics. So I had a gymnastics background, but dancing was different. And I was like, I'm on stage. I loved to be on stage. I loved the choreography and having to like string it along together and coming up with my own stuff. And so yeah, then I came back from that dance camp and I said, I want you to sign me up for ballet classes. And if you're not going to do it, I'll pay for it myself. I was like, I was really adamant about it. And that went on. I did like classical ballet and then point, and then I got more into like the contemporary dance, modern. I never tried tap. I feel like you have done tap dance before. No? You just look like you
God
could
no.
do a tap dance. Like, I think with all your footwork, I'm like, "Oh, he could tap." And then I even went into college at Georgia State, and I was on the dance team for, like, their football and basketball teams. And that's kinda where it ended, because I didn't like having pom-poms in my hand. That was it just felt more cheerish to me. But even living in Atlanta, I would go and take classes at Atlanta Ballet. I mean, it's always been a thing. And now, fast forward 2020, almost 2026, my goal in 2026, now that I'm postpartum, is to be in a dance show here in Chattanooga. I don't know where I'm going to find one. I don't know how
What?
I'm going to do it, but I want to get back on stage.
Oh, that's so cool. That's
Yeah.
awesome. You got to show all the behind the scenes footage.
I feel like that would be like a fun little bit on Instagram too, right? Like, hey guys, getting back on stage, haven't done a dance show in 10 years, maybe more. But then yeah, I don't think I started. If you go back to my original videos, I was not dancing, but I started to feel kind of bored with the just regular exercises I was posting. And
Hmm.
I was like, to your point, what's going to stop someone from scrolling and have them listen to what I'm saying? It's going to be me like jumping through the air and doing the splits or something. And so then that's what I did. And now it's more fun for me to make videos too.
Well, of course, yeah. Now it's a little bit more of an athletic component for you. I mean, that also explains your success on social media too.
Yeah. The only downside is I'm full on sweating by the time I'm finished filming a video because I'm like, this is a routine, but it's fun. It's fun. I'm
Yeah,
curious, is the social media following that you've built is pretty significant. Do you think that that's played into how people find you in your clinic in person?
definitely.
Oh, okay.
100%. I mean, I'll have people who are like, who'll come in and be like, "Hey, I've been following you for about 9 months now, and I've listened to everything you've said. I've literally been through everything you said, and that I am here because of that. Like, I am so ready to do something different. I'm so tired of living the same life over and over and over again and having no solutions.
Mm,
Because like the post is like what hooks people in, right? But then what I try to do is I try to stack a lot of information and value, and I'm trying to put out more informational posts as opposed to like the entertainment aspect. But
mhm.
on my stories, that's where I get a chance to really talk to people and give my thoughts and opinions and kind of expertise on the healthcare system. And so, the posts for the most part are like fun and entertaining and cool and all. But then, like, if you go into the stories, like, that's where I try to do a lot of education. That's where I try to, talk about certain concepts and certain things that I talk about with my own patients. And usually, 9.9 times out of 10, it really resonates with people because, again, like, if they're a chronic pain person, then they're literally living the life of all my patients just in different time durations and different pain locations.
Mhm.
Right. So, when people come in, I mean, people have been absorbing and listening to the content for a long time. I had someone come in from Pinterest. Like, I'm posting on Pinterest too. I've never
You
had
post
that
on
before.
Pinterest?
Oh yeah, I think we have like millions of impressions like every month. Like
I never thought to post on Pinterest. That's so funny.
yeah, it's kind of wild. Like on Facebook, I have over 500,000 people there. There's almost 600,000 people on my Facebook page there. Um,
Oh, interesting. Now, I do feel like, and this might be me making assumptions here, but I bet the chronic pain people spend more time on Facebook too.
you know,
I mean, they're probably on all
maybe.
the apps at this point, TikTok, Instagram.
Yeah,
I'm just
yeah.
thinking of someone that's a little bit more like my parents' age.
So what's interesting is that when you think chronic pain, you probably think older, right?
I do, but then
Uh,
you did just tell that story of the woman in her 30s, so I guess not. Maybe, yeah, I'm correcting myself.
yeah.
Maybe not. I take it back.
Wait till I tell you about the professional dancer in her 20s.
Wait, tell us.
So she came to me with really bad groin pain, and she's been in pain. She'd been in pain for a long time. She was like early 20s. She had a pelvic fracture from I think it was like I treated her about a year and a half ago, so I'm trying to just remember the details. But she had had a pelvic fracture like 2 years before, something like that, and she still had a lot of groin pain, and she had a lot of like referred pain going down through the inside of the thigh and around the hip, and she had been through a lot of providers, chiropractors, PTs, massage, like everything you can possibly imagine. She's been through it. And again, she's a chronic pain patient. She couldn't kick over her head. She couldn't stand on the leg. She had a lot of different problems. We cleared that out pretty damn quickly. And now, what she also didn't tell me that she actually had a pelvic floor dysfunction as well.
Mm.
And again, she didn't tell me that in the beginning. And I always ask, like, when someone tells me their story, I'm like, is there anything else that you're forgetting, or anything else that you want to tell me about, anything else that you feel like is important for me to know? And then like any other sprinklings of information is usually given. But she didn't give me that information until like the end. And she's like, oh, by the way, I had this issue and this issue, and like that actually went away as we've been doing everything. Is that normal? I'm like, I wish you would have told me, but yes, I mean, that it kind of as a byproduct helps that too. And yeah, like all the problems went away, and she was able to dance and perform however she wanted to.
Yeah, you know what? Chronic pain knows no age limit. I stand corrected. I think when I think of that initial chronic pain patient that I would see as a new grad, it was somebody that was, 65 and older a lot of the times, but it can be it can be anybody. And now that I'm thinking about it, even in my clinic, yes, we see a lot of athletes or people with like acute weightlifting injuries or something more specific, but we definitely see the chronic person as well. At what stage would you say you classify it as chronic?
So I mean, by book, right? It's like 3 months. I actually
Yeah.
take it back a month, and I consider anything that's over 2 months.
Yeah, kind
Uh,
of same.
yeah. I mean, most injuries, unless we're talking like a really highly traumatic injury, even a bone break, um, muscle tear, bone break, like these things typically get better. Like there's no plateau or increase in pain around the 2 month mark. Usually, it's still getting better, right? Most injuries, again, depending on the actual injury itself. If it's a high trauma case, it's obviously different.
Right.
But most injuries, they usually get better around the 2 month mark. Nothing plateaus or gets worse. So anything beyond that point, you are now a chronic pain patient. If it is staying the same or getting worse. Right. If it's getting better, I think you're good. Like I don't consider if you're actively getting better throughout the duration of time, like you're not actually a chronic pain patient. You're just going through the timeline of an injury. But if it's the same or worse, yep, that's it. Pretty
Wow.
much.
So you have built your practice up now. You mentioned your other physical therapist. How many people are practicing now at Project Physical Therapy?
So there's three of us in total, all PTs, and I'm hoping probably within the next 2 or 3 months or so we're gonna hire another one.
Yay, that's exciting.
Yeah, yeah, it certainly is. But Ronnie, I gotta tell you, my gosh, is it hard to find PTs?
Really?
Oh my God. It's bad. It's real bad.
Why do you think that is?
Because most PTs that come from working for somebody, for a clinic, private practice, doesn't matter. Uh, because of the way the system works, right? Most PTs come from insurance-based clinics. But if we, like what we talked about, the quality of those insurance-based clinics is pretty darn low, right? So to find a PT that's driven enough to do their own research, driven enough to
Mm,
get better outside of what is considered the clinical standard, which is again, I don't know if we're allowed to curse here or not, but uh,
you can. Although Apple Podcast did classify mine as clean, but you can curse.
I'll keep it light. It's considered dog shit. Uh, keep it light. Um, like that's it's very hard to find a PT when I go through the hiring process. As a matter of fact, the first PT that I have here that I hired, the second PT is actually his good friend. They went to PT school together. That's the only
Okay,
reason
so
I
there
have
was
him
a
here.
connection. Yeah.
Yeah, it was a connection and like the same school of thought. And
Yes.
there's Dr. Nick, Dr. John. I hired Dr. Nick first, and Dr. Nick was awesome, like really, really good, really like adapted quickly. I take all my PTs through a very, very, very vigorous training process. Even the interview is an actual. I test people on my interviews. My interviews are like 3 hours long. Like
Nice.
it's intense. Yeah, I fired PTs before. I have
Yeah.
fired PTs, which is
I
a
mean,
big
in 6
taboo.
years of business, I would assume so, yeah.
Yeah. and very quickly. Like you're either ready to step onto the coals in the fire and get better, or you're gone. Because people who come in here who trust us, like forget the money for a second, yeah, because we're not cheap either. Forget the money for a second. Someone is trusting us with their body. Someone is trusting us with their energy, with their time. Time is such a precious, oh my God, it's a precious resource. Time, we never get that back. Money you can make back, right? Happy moments you can make in the future too. But time, once you lose time, you never get that back. Every day that someone spends in pain is another day that is wasted in pain. That someone can't live their life how they want to, how they used to live their life before the pain started. And I am in the business of bringing that life back to them as soon as humanly possible. And if you can't do that job, get the fudgesicle out of here.
Yep.
That's the motto.
Yeah. I feel like I would be a little scared in an interview with you. I'm just kidding.
Nah, you'd rock the house, Ronnie.
No, I do think that it's worth mentioning though, and this might just be my experience and not yours, but there are a lot of really good quality physical therapists just in positions that are kinda shitty for them at the moment, kinda like myself included, and I'm thinking about, my clinic director who I was working with for the 2 years before I went off on my own. Uh, Super smart guy, great physical therapist, and honestly, a really good multitasker and able to really to get people better, not maybe in the most perfect ideal way that he would have it, but he was still super skilled. And so I don't necessarily think it's the physical therapist's fault. Sometimes they're just failed by the system. So you take this really brilliant brain and then you put them in a clinic for 5 years treating 3 people at a time. They're not used to having to do their own research. They're not used to having to think outside the box because they don't have the time. So it's unfortunate, but I do think that there are probably better quality PTs out there. They just might not be up to your standard of like, now we really got to up our game. You know what I mean?
For sure, and I don't disagree with you at all there. I will add though, there has to be, so like I'm not looking for perfection. Like I know that whatever PT I'm going to interview, the likelihood of them, like of us being on the same level from the get go, is very unlikely. I'm not like delusional about that. I know that, and I'm okay. Like that's cool. I'm cool with that.
Mhm.
I mean, and hey, if I come across a PT that's better than me, oh my God, I want you even more. I'll pay you whatever you want. I don't care. Like cool. Like I want everybody to be better than me. I don't want to be the best in the room. I do not want that. Uh, but what I look for is a general curiosity of exploration. Like I'm looking for someone to be outside of the whole glue bridges, clamshells, and monster walks, or little pulleys for the shoulder, little wall, finger crawls up the wall. I'm looking for something more than that.
I forgot about the pulleys. I don't even have those.
Same. You won't find it here.
Yeah.
I have a 60-pound band though. That one's a lot of fun.
Yeah, there you go.
But like I'm looking for that curiosity. I'm looking for people to connect the pieces. We all learn anatomy. Let's be real. We all learn anatomy. We all know the muscles. We all know the nerves. We all know the joints, how they operate. Like you need to be able to put two and two together. If someone has, okay, real quick, this one I almost punched my screen when I was doing the podcast episode.
Well, let's hear
Uh,
it.
so it was the radio talk show portion of the podcast, and this woman is describing me her symptoms, and she's mentioning top side of the hip. It's like burning pain. It's constantly stays there. Sometimes it travels down the outside, like along the IT pathway, a little bit on the front of the thigh. And again, like I'm emphasizing, like, hey, like, again, I'm not. We haven't done an evaluation. Like I don't know. I haven't tested anything, but I'm just curious. Like you've been to PT. What did your PT say? Again, outside of the hip, top outside of the hip, sometimes going down the leg. You know what the PT says? Guess. Oh my God, just guess.
IT band.
No.
What?
Psoas.
What?
Exactly. I
No.
almost punched the screen. I was like, what? How? How? Why? In what world? For what purpose?
Yeah, yikes.
And also, it's burning. That's a nerve symptom. Like, what are we talking about here?
Psoas is totally one of those catch-all muscles. I swear, it's the psoas, and then oh, what's the other one that everyone? It's yeah, your glute amnesia. Um,
Oh my God.
yeah, release your psoas is one that's really it's on fire these days on the internet.
You're piriformis.
Your piriformis, thank you. Everything is
Mm-hmm.
piriformis syndrome. I'm like, do you
Yep.
know how actually rare it is to have a true piriformis syndrome? Like
Yeah.
every personal trainer sends me a patient. They're like, they've got piriformis syndrome. I'm like, oh, okay, all right,
No,
we'll treat
I've
that.
got, yeah, I got a piriformis syndrome. No, no, no. What you have is a dumb doctor.
Yeah, yeah.
Oh my
Oh,
God.
that's yeah, lots of misinformation, but that's okay. I think I've talked about it before in the podcast for sure, and I harp on it all the time in the clinic. Education is the probably most powerful thing that we can give to our patients. We can do the manual treatment, we can give them exercises for home, but talking to them and doing it in a way that's going to make a lasting impact, even if they only remember like 10% of what I tell them throughout the whole plan of care, or 10% more educated, and that's going to empower them to like be able to deal with their stuff on their own. And that's what I
Hmm.
love. I really like talk until I'm blue in the face when I'm in the clinic. People are probably like, please shut up, but I like it.
Hey, for the sake of clarity, you got to do it.
Yeah,
Uh,
exactly.
I'm right there with you. It's information, education. Like we have this app on our tablets. Everyone has a tablet here, and so like when we explain things, we show different nerve pathways and muscle pathways, and the patient's like, "Oh my God, that's exactly the line of how my pain usually goes." And like it's like that connection of like they feel like it's a justified feeling, like they feel actually acknowledged and like validated that, oh my God, like okay, you're actually listening to what I'm telling you, and we're actually looking for the problem. Okay, I feel calmer, I feel safer, I trust you, I can trust my care, my body in your hands, and like I know what's going on, and that safety is so important.
Yes, and honestly, the power of some visual information, just like how people love their MRIs and their X-rays to see like what's going on, quote unquote. If
Hmm.
they don't have that, I also have an iPad in the clinic and I'll pull up my Essential Anatomy app and show people just like you were saying. And it is sometimes it's like the thing that buys them in. They're like, okay, you know what? Yeah, she definitely knows what she's talking about because she showed me that anatomy app. But it
Yeah.
really is so powerful. People love it. And I also think that the power of repetition is something that shouldn't be underestimated, because I will say something one time and be like, "Yeah, we already talked about that." Or at least I would do that maybe about a year or 2 ago.
Hmm.
I don't why am I still saying this 5 visits in? But really, like they're not gonna absorb everything that you're saying. You have to be really repetitive about the things that are worth being repetitive about, and then they'll remember, and then they're gonna be better.
Yeah, you've said it 1,000 times, they only heard it that one time.
Exactly.
Yeah.
Yeah.
I'll do the same thing. Literally,
Mhm.
see, that's the mark of a good clinician. That's the mark of a good clinician: clarity, consistency, persistence. Like but that's also what I'm looking for. Like when we're talking about bringing on PT on for the team, like that, I need some semblance of that ability. The communication aspect is something that I value over clinical skills.
Same.
You know,
Same. Yeah, I think I got really lucky with the PT that I hired. She was the first person that applied, and I got several applicants, but she was the first one that applied, and when I looked at her resume, I was like, "This has to be a joke. There's no one's that perfect." Then she came in for the interview, and I was like, "How? How is this possible?" But I don't know. If I continue to grow and I end up, growing to the size that you are, maybe I will have to hire and fire people, but hopefully not.
you mean when you continue to grow.
Yeah, yeah. Love that mindset. There we go. That's good. That's good.
That's a
Uh,
chronic pain mindset.
you mean when?
You
Uh,
mean when exactly?
so before we close it up, I love to ask people this question. Now, you've been out of PT school for how long?
2018.
2018. Okay. So it's been about 8-ish years. Can I do math? 7-ish years since you were out of school?
Hmm.
Yes. If you could go back to your Danny Shapiro DPT student self and give yourself one piece of advice, what would it be?
Stay curious. Curiosity is everything. Curiosity is what drove me to this point. Curiosity is what made me go around every quote unquote impossibility by the textbook, and to help people truly be their best self. Curiosity is the biggest driver of success, in my opinion, when it comes to patient care. If you're not curious enough to try, and if you're not curious enough to experiment, if you're not curious enough to not do the traditional things, you'll never get the results that people want.
I love that. I think that's a common theme of this podcast. It's part of the reason the podcast exists, is because I, like you, am curious and want to hear from other people and continue to learn. Being a lifelong learner, that's where it's at.
Yeah. Oh yeah,
Yeah.
absolutely. And by the way, if I had to go back to my DPT days, well, actually, so you recently did a podcast episode with the physio tutors.
I sure did.
I went to school with them.
No, you didn't.
Yeah, we went to the same school.
What?
They were like 2 years above me. Yeah.
So you know Kai and Andreas?
Yeah, Kai just came to visit me a few weeks back. He was in New York and he popped by the clinic. Yeah.
You know what? The more that I am in this world and doing this podcast and creating things on Instagram, the more I realize how close knit the PT world really is.
Yeah, you know what's funny? Dr. John, he actually he saw on my schedule that we were doing this podcast together. He's like, "Oh, is that's Ronnie? That's Dr. Ronnie?" I'm like, "Yeah." He goes, "Oh, that's so cool. I've been following her for a while now. Like that's so
Aw.
cool that you guys are doing an episode together." I was like, "Yeah." I told him, when you make enough waves, when you're loud enough within like the social space and the especially in healthcare, you will know people. Like you know, you kind of it's a small world.
It is a small world and it just keeps getting smaller. And it's funny because I don't know if you've experienced this, but when I post on social media, I just it's not like I forget that people are seeing it, but I definitely don't expect it to reach people. I don't know what I'm expecting. You know, you hope things do well and you hope that it is informative and it's reaching the right people. But it's stories like this when someone from New York is like, oh, yeah, I've been following her for a while. It always baffles me. I'm like, what do you mean you've been following me? No, you haven't. No one sees my stuff.
We all see your stuff, Ronnie. It's
Yeah.
good stuff.
Well, thank you. Honestly, likewise. I love following you. And yeah, you've been an amazing guest. And I think the next move is I'll come on your podcast if you still want to have me, if I'm still welcome.
I don't know, Ronnie. After this conversation, I don't know if we mesh well. Our personalities are good. I don't know. Yeah, Ronnie. No, it would be awesome to have you on. I think
All
it'd be
right.
incredibly valuable for the audience.
Sweet. Well, I'm looking forward to it. Thank you so much for your time. And yeah, until next time.
Hell yeah! Thank you for having me on.